in the middle of getting questions and I just couldn't walk away that easily. Sorry about that. And thanks so much for waiting. I feel like I'm glad that you're all still here. Jessica, just to clarify, the script that you've given me, the one I should be looking at is the time sent. I'm just going to go with the one sent at 9:52. Is Jessica on? Yeah. Yes, okay. All right. Hi, Chris. Do you want me to just get started?
Yeah. I also wanted to thank everyone for being so patient and waiting. I think we really appreciate it. Yeah. So without further ado, Dr. Young-Hoon, if you'd like to give the update, and then we'll move into questions.
Okay. So unfortunately, our case numbers were updated on the website today, but are incorrect due to a glitch in the reporting system. They are being corrected as we speak and will be updated shortly. The daily email will be sent with the accurate numbers as soon as possible, and the website will be revised. It is concerning that we continue to see a high number of new cases each week, despite being in a stay-at-home order. Following public health measures and not looking for ways to bend, break, or ignore the law is critical to be able to reopen. Keeping numbers down means less chance the virus can mutate and give the vaccines a chance to work. The consequences of not doing so have very real impacts that go beyond being charged. The reality of people choosing to violate the law and ignore public health measures will prolong the shutdown and continue to increase cases and illnesses in our area. These decisions can jeopardize people's lives and livelihoods, and they put our local healthcare system at risk. As Mother's Day approaches, please do not gather with anyone that you do not live with. This is how COVID-19 is spread, through close contact with others. Over 31,000 COVID-19 vaccine doses have been given in our area. This is an impressive number, and we expect it will begin to rise quickly over the month of May as more populations become eligible. Yesterday, those aged 50 years and older become eligible, as did people with high-risk health conditions and essential workers in Group 1, according to ministry definitions. More information on each population and expected dates that others will become eligible can be found on our booking webpage. All appointments can be made using the provincial booking system, either on their website or through their call center. Okay, I can take questions.
So first up, we have Atikokan in progress. Okay, so they've said they have no questions. So TBT News, you are next.
Good morning, Doctor. Just want to start off on the news that going forward, that the health officials have announced that after someone gets their first dose of the AstraZeneca vaccine, they can get their second dose, can either be the Pfizer or the Moderna vaccine. Have you heard anything on this front? And if so, just your reaction to that announcement.
So I've not heard anything on that, but I've not also checked my emails today as yet at this meetings. At this point, we are waiting for guidance from the National Advisory Committee on Immunizations with respect to the second dose and whether it is interchangeable with other vaccines.
And just to follow up on a bit of a different note, I mean, there's over 20 active cases, and I haven't seen the updated website since it's been re-updated, I guess you could say, but over 20 active cases in both Kenora and Sioux Lookout. Is there any indication on why, and you mentioned earlier, we're still in a stay-at-home order and the cases continue to rise. Is there any indication of where these cases are coming from at this point?
So at this point, we are seeing cases across the entire catchment area of Northwestern Health Unit. And it does change over time. So sometimes in one health hub, it might be high, and then it will become low as case and contact management becomes more effective in controlling the spread. There are a number of health hubs where case numbers tend to be high historically, and that will include Lookout Health Hub and Kenora Health Hub. And they do have currently a relatively higher number of cases. So for both of those health hubs, it's often a number of different communities affected, not just one specific community. And we are seeing that in general across the entire catchment area that there's a trend with workplace outbreaks, and that workplace outbreaks now can be quite large. So some of the outbreaks can have up to 15 or even more cases than that. And that there's, although we believe most workplaces are following public health restrictions, we have noted that with workplace cases that there is a trend of cases coming to work sick and not necessarily following public health measures at the workplace. So that is an issue that needs to be looked at more closely with respect to workplace cases and outbreaks.
Okay, and then Natalie from Fort Francis Times. Do you have any questions? Okay, perfect. So no questions from Natalie. Ryan Forbes from Q104. And his question is via chat, and I'll just read it out. Hi, Kit. What can you share about the vaccine variant of concern?
So most of the variants of concern in Northwestern Health Unit are the UK variant. The UK variant is concerning because it increases the risk of death and also increases the risk of being admitted into intensive care units. We have been notified of one case, which is the variant of concern that's originated in Brazil. What we know about this case is that it does not appear to have spread to other individuals in our catchment area, and that this case potentially could have acquired that variant outside of our catchment area because of travel associated with that particular case.
Okay, so no follow-ups. So next we have CJRL.
Hey, Dr. Kit, it's I was talking to someone this morning. They got their vaccine, and he was supposed to get a Moderna vaccine, but he got a Pfizer instead. So my impression, we weren't getting any Pfizer, but obviously that's not true. Is it based on availability or what?
That's right. Exactly. So in the beginning of the vaccine rollout, we were primarily getting Moderna in our catchment area. And so that was being rolled out through all our vaccine clinics and other partner agencies' vaccine clinics. The Moderna supply to the province has become more unstable. And in order to ensure that we had enough vaccine, the province started supplying us with Pfizer to ensure that we have enough vaccine, the province has been supplying us with both Moderna and Pfizer vaccine. And at this point, most of our vaccine distribution will be with the Pfizer vaccine.
So about a half an hour, I'm supposed to get my vaccine shot. Do you think I'll get a Pfizer or a Moderna?
At this point, we have both in our inventory, so it could be either. Just to reassure the public, all vaccines are safe. The Moderna vaccine and the Pfizer vaccine are very similar. They're the same type of vaccine, so they're both mRNA vaccines. And both vaccines have similar levels of effectiveness and side effects. And the side effects associated with the Moderna vaccine and the Pfizer vaccine are relatively not important. So in the sense that there's side effects such as chills, fever, body aches, and so on that could occur with the vaccine, but they're short-lived, and they generally don't prevent someone from being able to go to work or do other daily activities that they might need to do. For the most, they may require people some people may feel unwell for a day or two, but then they recover fully and they're fine. So there are very few serious side effects associated with the Pfizer vaccine and the Moderna vaccine. The main serious side effects associated with those vaccines would be a severe allergic reaction, and that is very uncommon. And we do have staff that are available at the vaccine clinics to respond to a severe allergic reaction because they usually occur within 15 minutes. So I hope that helps to provide some reassurance to the general public that when they show up at a vaccine clinic, they could be offered either Moderna or Pfizer, but that they should have no concern with accepting either vaccine.
Thanks.
There's just a message from Jessica Kibble in the chat box, just clarifying some information about when you're going to get your vaccine and about the vaccines themselves. So next we have Mike, and I don't want to butcher your last name, I'm sorry, Eppeling. No questions. So next we have Randy Thomas.
Hi, Dr. Kitt. A question about the workplaces. Are you getting many requests for workplace clinics at all?
We get the occasional request for workplace clinics. At this point, we're encouraging people to attend mass vaccination clinics and to book through the provincial booking system at any of those clinics. At this point, we have a fair number of clinics across our entire catchment area that are that should be accessible to almost anyone, and there's a fair number of appointments available in May for anyone who wants to be vaccinated.
I know some businesses are thinking about acquiring the rapid tests. Any concern about these businesses using those tests and maybe using them incorrectly, leading to either more people going to the assessment centers when they really shouldn't be going to the assessment center, or maybe they should be going to the assessment center and the rapid test suggests that they don't?
The province, along with Ontario Health North, are rolling out a testing initiatives that target workplaces and involve using rapid tests. So I think those questions probably better are targeted at Ontario Health North or probably at the provincial level. My general sense is that in providing that equipment, they do provide a fair bit of guidance as well on how to use the equipment correctly, who should be doing the testing, and what to do with the results. For any workplace that's doing rapid testing, if you have a positive test result, it's necessary and required that you inform public health so that we can follow up on those individuals. Depending on the type of test that they are using, depending on the type of testing equipment they're using, individuals may need to be retested at an assessment center if they're positive.
Okay, so next we have Tim Brody.
Yes, good morning, Dr. Kitt. Just wanting to follow up a little bit on the news release that went out yesterday about more COVID-19 variants of concern. It mentions the number listed since January, but I'm wondering if we have any information specifically covering the period of the provincial shutdown or lockdown. You've mentioned, again, some concern about cases not going down despite these measures that have been taken place. And I'm wondering if the variant is contributing in any way to the numbers that we're currently seeing right now during this lockdown.
So likely the variants of concern are contributing to the increase in numbers as well. They are more transmissible. And so they do lead to, when public health measures are not being followed, that it affects a larger number of people than what we've seen previously in the pandemic. So some of our outbreaks do involve it can range from anywhere from 5 people to 15 people. Sorry. Some of our outbreaks can involve up to 5 or even up to 15 plus or even more number of cases. Sorry, I'll try that again. Some of our outbreaks have involved very large number of cases, up to 15 people or even a little bit more than 15 people. And that is greater than what we've seen in outbreaks in the past, and that's likely because variants of concern are more transmissible. So it is necessary at this point for everyone to be following public health measures as much as they can in a very strict way in order to prevent transmission of COVID-19 in light of the variants of concern.
Okay, and one other question that I wanted to follow up on. Again, there's been concern expressed about people not following the rules. Some concern as well about people potentially going to work, if they're ill. Is the health unit hearing or has noted any other areas of concern about people not following the rules, other than perhaps hearing about people maybe going to work with at least one symptom, or maybe feeling under the weather? Are there any other ways that people are perhaps not following the rules?
So the stay-at-home order is relatively sorry, maybe let me think about that one a little bit. I think we hear on occasion different things from clients and cases and so on, and just what we complaints that we might get through the hotline or on people not following the rules. So I'm imagining it's not something that's necessarily that there are probably other ways that people are not following the rules that we just might not know of. There are also a proportion of cases where we don't know that where they have acquired the virus. And so it could be that there's more circulating in the community that we're not aware of. So I think it is very much important at this time, particularly if we want case numbers to come down and we don't want to have a negative impact on our healthcare sector. And we want to be able to move back to life as normal. We do need to follow public health measures at this time and follow the stay-at-home order. The vaccination rollout is for everyone to get first doses likely won't end until sometime in June. And it does take some time for the vaccine to work. So it's about a 2-week window after getting that first shot before you have the protection from that first dose. So we do, as a population, we do need some time in order for the vaccination to roll out to be effective and for us to collectively come out of the pandemic and to be able for public health measures to be lifted. So I think everyone's very tired at this time, but we do, at this point, it is in our collective best interest to follow public health measures for a longer period of time in order to prevent the spread of COVID-19. I hope that answers your question, Tim.
Yeah, no, I think that mainly does. I just wasn't sure, like I said, if there were instances of non-essential travel, maybe people gathering when they weren't supposed to, that were also contributing to the health unit's concern about people not following the rules, or if it was just simply mainly people going to work ill.
No, it's not only just one thing. It's always multiple things. So we are also seeing people gathering, and household to household spread is still an ongoing issue as it has always been throughout the pandemic.
Thank you for clarifying. Thank you.
And last but not least, Olivia Lebec from CBC.
Hi, Dr. Yanhoon. I'm just thinking back to when Thunder Bay was experiencing multiple outbreaks and high numbers in our district. Our health unit said at the time they're kind of cobbling together resources to deal with the demand. I'm just wondering what position the Northwestern Health Unit is in as you sort of deal with rising numbers and more variants of concerns. Is the health unit able to support that demand right now, or is there need for other resources?
So that's a great question. Case numbers are high, but they're not to the level that at this point, case numbers are not at a level where we require additional supports from other agencies in order to do case and contact management. So we have a great team at Northwestern Health Unit. They've become extremely experienced over the course of the pandemic, as well as they maximize use of all provincial supports and ensuring that work's done as efficiently and as effectively as possible. So at this point, we are not concerned about capacity to do case and contact management. If case numbers were to worsen significantly, though, we would be in a situation where we would be reaching out to other health units for help in doing case and contact management, and also reaching out to local partners to help support the vaccination program. Right now, many partners support the vaccination program throughout a catchment area, so we appreciate that work. But because our health unit has a limited size and we're stretched in two directions with respect to case and contact management and the vaccination program, if our case numbers were to escalate significantly, then we would need to shift some of our resources towards case and contact management and ask for more supports from local partners on the vaccination program. I think one of the ongoing challenges, however, is that for all healthcare agencies, we are stretched and we have lots of other work that needs to be done. And so if COVID case numbers were to increase, it not only negatively impacts the demand on our workload, but it also has a negative impact on the workload for healthcare service agencies such as the hospitals and primary care. So part of what we do when following public health measures is we're protecting our healthcare service sector to be able to provide services for other healthcare reasons.
Thank you. That's all my questions.
Great, and we'll just open it up now to follow-ups. I know TB Newswatch has messaged me directly, and so after them, we will open the floor to follow-ups.
Yeah, thank you. Just regarding the release that was put out yesterday with respect to the variants, it states in the release that VOC cases may also be in other communities as lab identification of variants is not possible for all samples. I was just wondering if you could clarify what that means and why identification isn't possible on all the samples.
So at this point, all samples are screened for variants of concern. And some samples, however, don't have enough virus in them to be able to do that additional testing, that additional screening test to determine if it's a variant. So roughly about 10%, depending on the type of samples, it can be a bit more than that. We get a no result. We don't know what the results of the screening test is, and that's because the amount of virus in the sample was not large enough.
And just to follow up, what we're seeing in Southern Ontario, the UK variants leading to record numbers of hospitalizations and ICU admissions. Is there a reason why that you can think that the Northwestern Health Unit isn't seeing a spike in hospitalizations as well, or are you concerned that that's still on the horizon?
So I think it's good news that we've not seen escalating numbers. It has been seen in some parts of Southern Ontario. There could be a number of reasons for that. One could be that the vaccinations, particularly, so there could be a number of potential reasons for that. It could be that the vaccination program is having an effect in blunting that the increase in cases that we are seeing right now. I think overall, though, I am concerned that if case numbers keep on increasing, that the vaccination program won't be coming in time to prevent that increase in cases that could affect us. So it does feel right now that we are needing to be patient and wait for the vaccination program to be effective before we can think about being able to connect with others in person and to come, and that it is necessary at this point for us to follow public health measures until the vaccination program's been fully or more fully rolled out. Did I answer your question?
Yes, thank you very much.
Does anyone have any other follow-ups that we can address? Okay, silence.
quickly, I have another question about workplaces. Last time we spoke, Dr. Young-Hoon, you mentioned that you're hoping that employers will work with employees in order to ensure that they can stay home if they are showing symptoms. Have you received any reports maybe from employees who say that they maybe don't have a choice? And if so, is there any way to maybe level any kind of repercussions or maybe even fines against workplaces who are forcing employees to come to work?
We are looking at that closely to see how best to ensure appropriate enforcement for workplaces, that they will support employees to stay home if they're symptomatic or they're a case of COVID-19. So that is something that we are looking at and reviewing closely.
Okay, one last call, but I think that might be it for today. Let's give it a second. Okay. No, so thank you everyone for taking the time this Friday morning. We appreciate all of your questions and hope you have a good weekend. Thank you, Dr. Kitt.
Yeah, thanks everyone. And thanks again for waiting for me. Have a good weekend. Thanks.